Hi, my name is Dayne Ornelas Gonzalez. I am in the Masters of Human Development Research and Policy. It's a HDRP, and it is a one-year program. So I am first year and last year. In undergrad, I had majored in psychology and neurobiology, and I had the chance to work in a couple of labs. And then post-grad, I worked in clinical research, and I always thought I wanted to be a child psychologist, and then realized after that lab experience that I did not want to be a child psychologist. So I switched from clinical research to policy and working at a nonprofit research organization that looks at how research can inform policies that affect children and families. And in working in this organization, I realized that this was something that I wanted to do in the long run. Yeah, the research that I'm interested in is looking at how we can support the early childhood development of children who are migrants, whose families have been displaced, and those that live in hostile, volatile conflict areas. I'm really interested in looking at what supports families need in these contexts, and particularly what services, programs, and public policies can inform those services and programs, and how we can ensure that these families and children have a safe and holistic environment. I'm particularly interested in research that's going to inform policy. So looking at how the research evidence that we come up with is going to lead to policy interventions, as well as research that's really centered on the families and the communities, and that's culturally grounded. I think that for me is really important in any type of research that I'm looking at. Highlights from this program, I would say I would put them in two buckets. So the first bucket, it would be definitely my cohort. We are a total of 8, and we are led by our director, Alejandro, who is so kind, funny, and has really been extremely supportive throughout this program. He has gone out of his way to really personalize this program for all of us. And I would say the other bucket that has been a highlight for this program has been the faculty here at Steinhardt. I've taken courses, particularly I think it's called the Social Justice and Intervention course that I took from Dr. Bilali. That really changed the way that I think about solving social justice problems, and the way that I frame the problem, the way I think about interventions. This past year, I got the opportunity at the nonprofit organization that I work at to work in an impact evaluation for an infant and toddler program in the state of North Carolina. And one of my tasks was to lead an advisory parent panel, primarily of Spanish-speaking families, and understanding their access to infant and toddler programs in the state of North Carolina. And through those focus groups, I learned a lot about the experience of these families, particularly with barriers to access the programs and services that they want and need for their children, or to support their child's development, and reporting those findings back to my team, and then having my team report those findings, back to the state administrators and stakeholders who are responsible for creating those programs, was something that I had never really seen, that full circle of, right, from like interviewing families and then analyzing the data, and then reporting and elevating what families were telling us they wanted and needed out of these programs, and then having those findings be reported to stakeholders that can actually have an impact in making these programs and services, was something that I had never really seen research being used that quickly to inform and change programs that will eventually have an effect in families. So I think when I saw how that link happened, and I saw how impactful and how we were able to elevate family voice so that it's in the hand of policymakers, was something that I realized that I wanted to keep doing.